morning. Today we will discuss on nutrition and oral health. Nutrition is an essential and continuing component in the complex process of maintaining optimal health throughout life. A good nutrition involves adequate intake of nutrients like protein, vitamin, and minerals which enable us to grow and enjoy good health. Before going into the main topic, we'll first discuss certain terms which are important in nutrition. First is diet. Diet is defined as the type and the amount of food eaten daily by an individual. Next is nutrition. Nutrition is defined as the sum of the processes by which an individual takes in and utilizes food. Next is malnutrition. Malnutrition is a pathological state resulting from a relative or absolute deficiency or excess of one or more essential nutrients. Balanced diet. A balanced diet might be described as one providing each nutrient in the amount needed to maintain optimal health. It should not be deficient or should not be excess. Coming to the classification of food, we can classify food under 4 main categories. First one is by origin. Based on origin, we can classify food into foods of animal origin and foods of vegetable origin. Next is by chemical composition. Based on the chemical composition, we can classify food into proteins, fat, carbohydrate, minerals, and vitamins. Based on predominant function, we have bodybuilding foods, energy giving foods, and protective foods. Example for bodybuilding foods are milk, meat. Example for energy giving foods are cereals, sugar, and example for protective food includes vegetables and fruits. And the last category is based on nutritional value. Based on nutritional value, we can classify food into cereals, pulses, vegetables, nuts and oil seeds, fruits, animal foods, fats and oils, sugar, and jaggery. Now we'll see nutrients. The nutrients are organic and inorganic complexes contained in the food. We can classify nutrients into macronutrients and micronutrients. Macronutrients form the main bulk of food. Example, proteins, fat, and carbohydrate. Micronutrients are required in small quantity. Example, vitamins and minerals. Now comes the food pyramid. Food pyramid is also known as food gate pyramid, which helps us to choose variety of foods to help to achieve a balanced diet. This food gate pyramid was introduced by United States Agriculture Department, and it is available in internet. We can Google it, and if we give our daily activities and our height and weight, they will provide the list of foods which we need to take for getting a balanced diet. Coming to the effect of nutrition on oral tissue. Nutrition and oral health are intimately linked. The diet and its nutritional consequence can have a profound influence on tooth development and maintenance, and on the development and progress of diseases with oral manifestations, and may influence the diet and nutritional status. Coming to nutrition and dentition, the nutrition has both pre-eruptive effect and post-eruptive effect on dentition. Coming to the pre-eruptive effects, the malnutrition can cause various problems in dentition during its pre-eruptive effect. The physical and chemical properties of enamel could be altered in the direction of decreased dental caries susceptibility because of malnutrition. The enamel maturation, physical and chemical composition, time of eruption, tooth morphology, and size are all affected by pre-eruptive nutritional intake. Dental dysplasias associated with malnutrition includes enamel hyperplasia, odontoclasia in deciduous dentition, yellow teeth condition seen in permanent dentition, infantile melanodontia, which is observed in deciduous dentition. Coming to post-eruptive effects, the post-eruptive effects of malnutrition, particularly protein deficiency, can lead to decreased salivary lysosomes and secretory IgA levels. Any alteration of salivary protein could have negative effect on the susceptibility to dental caries. Next is nutrition and malocclusion. The malnutrition disturbs development of jaw bones. This can result in class 1 type of malocclusion with poor tooth alignment and crowding, which can lead to increased caries and periodontal disease. Coming to nutrition and periodontal disease. Nutrition does not have a direct effect on periodontal disease, but indirectly it influences periodontal disease. When local factors are conducive to the production of periodontal disease in man, it is believed that the rapidity of the destruction is determined to a considerable extent by constitutional factors, of which nutritional status may be an important factor. The main target in nutritional deficiency are the epithelial barrier and attachment, periodontal ligament, gingival connective tissue, alveolar bone, cellular immune mechanism, inflammatory response, composition of gingival fluid, as also clavicular epithelia. Now we'll see the deficiency of certain elements on gingiva and periodontia. First is the deficiency of iron. Gingiva will become pale in color. It also leads to impaired neutrophils bactericidal activity and reduced lymphocyte response to antigen, and thus increasing the risk and the severity of infection. It also causes reduced thickness and delayed maturation of epithelial barrier. Deficiency of protein. Deficiency of protein increases susceptibility to the periodontal infections. Deficiency of vitamin C causes teeth exfoliation, reduction in salivary flow. Deficiency of vitamin A causes decreased salivary flow, hyperkeratosis, and gingival hyperplasia. Deficiency of vitamin B complex predisposes gingiva to ANAND. Deficiency of vitamin K leads to gingival bleeding and post-extraction hemorrhage. Deficiency of calcium and phosphorus causes severe alveolar ridge resorption. Now we'll see the benefits of good nutrition on periodontal infection. If we are having a good nutrition, if we are having a good nutritional intake, we will be able to resist infection, and this will help to strengthen and maintain the epithelial barrier, and also will promote repair of damaged periodontal tissues. Coming to nutrition and oral cancer, the nutritional factors protect against tumorigenesis by acting as a blocking agent, altering metabolism of carcinogens, increasing detoxification, and by scavenging the active molecular species of carcinogen. The vitamins which help us to fight against carcinogenic cells are vitamin A, vitamin C, vitamin E, and vitamin B complex. Now comes to nutrition in elderly population. We all know that elderly population are suffering from malnutrition. A major problem of many elderly person is limited physical capability to digest and absorb food. This may be due to the inability to chew food thoroughly, because when we become older, or for older age groups, they will not be having a sufficient amount of teeth for chewing, so they will not be able to chew food thoroughly. That will be the one of the important problem for malnutrition. Then diminished appetite. They will be taking so many medicines because of many diseases, and these medicines may have an effect on appetite, so they will be suffering from diminished appetite. And also the diseases, they will be suffering from a lot of diseases, systemic diseases, and all. Or so these things will reduce their capability to digest and absorb food. Now comes to the preventive and social measures which should be taken to prevent malnutrition. The problem of malnutrition can be solved only by taking action simultaneously at various levels. That is, action at the family level, action at the community level, action at the national level, and action at international level. First is action at family level. The actions which can be taken in family level includes nutritional education about the kind of food and the planning of nutritional adequate diet, then identification and correction of harmful food taboos and dietary prejudice, promotion of breastfeeding in infant and child feeding practices, and the promotion of a kitchen garden or keeping a poultry in home. Coming to actions at community level, analysis of extent, distribution, and type of nutritional deficiencies, the population groups at risk, dietary and non-dietary factors contributing to malnutrition, and supplementary feeding programs. A midday school meal can be executed. The real solution can also be obtained through fundamental measures which correct the basic cause of malnutrition, increasing the quality and quantity of available foods. Coming to the actions that can be taken in national level. In national level, the points includes increasing agricultural production, stabilization of population, nutritional intervention programs like iodized salt, the tablet for anemia, vitamin A for blindness, etc. And also nutrition related health activities like malaria eradication programs can be taken. Some nutritional programs in India are vitamin A prophylaxis program, prophylaxis against nutritional anemia, iodine deficiency disorder control program, special nutrition program, Balwadi nutrition program, ICDS program, and midday meal program, which is the most popular nutrition program in India. The midday meal program was first started in Madras, then it was taken by the central government. Now comes the actions at international level. In international level, there are so many agencies which are ready to help to act against malnutrition. The agencies like UNICEF, WHO, World Bank, and CARE are ready to help nations, national governments in different part of the world in their battle against malnutrition. Coming to the conclusion, nutrition is vital to human development, growth, and health maintenance. Nutritional issues at the forefront of popular culture are the part of the current wellness and health promotion climate. Within the community, dentists are strategically positioned to be advocate for a better understanding of how oral health and systemic health are related, and to be effectively involved in the health promotion efforts and to advocate wellness for the patients while improving or maintaining their oral health status. Thank you.